All right. So hi, everyone. My name is Kyle Jackham. I'm a licensed social worker and the program coordinator for Crossroads for Hope, formerly known as Cancer Support Community Central New Jersey. We are happy to welcome you to Strengthening Your Wellbeing with Acupuncture. Before we get started, I would like to first introduce our organization, Crossroads for Hope. We are an independent 501c3 nonprofit organization located in Bedminster, New Jersey. Our organization helps all those touched by cancer to move through a health crisis, to become more active and empowered by taking control of their health and well-being. Our network of support embraces all people touched by cancer, the diagnosed and their loved ones, providing access to resources and evidence-based programs of support, education, well-being, and hope, and offered free of charge. We are committed to upholding the dignity of all people through respect for gender identification, sexual orientation, race, ethnicity, and income differences. Our vision is to be a safe space to turn to first for restoring one's whole being and improve the life of people with cancer and their families beyond the diagnosis. Our presenter today is Dr. Vanessa Rugeles. During today's presentation, we will learn how acupuncture can address some of the most common side effects of cancer therapies, reduce discomfort, support your emotion and physical well-being, and help you live well. And once again, if you feel free to drop any questions or comments you have in the chat box, or you can use the Q&A feature, and we will be sure to answer them when we can. Thank you for joining us today. Vanessa, I will hand it off to you.
Hi, everyone. Welcome, and thank you for being here. Thank you, Kyle, for that introduction. So I'm really excited to be here today. We're going to be diving into acupuncture and traditional Chinese medicine and talk about how different TCM therapies can really support individuals undergoing conventional cancer care and thereafter. So to share a little bit about myself, I am a licensed naturopathic doctor and a licensed acupuncturist. I practice in Westfield, New Jersey, and I support individuals that have digestive challenges, as well as individuals that have digestive discomfort and are undergoing conventional cancer care, and after those who are struggling to restore digestion after cancer therapies. And I do that with the use of functional lab testing, as well as targeted nutrition and targeted nutritional supplementation, lifestyle counseling, and definitely addressing the root cause of disease and getting to the root of what's happening. So that's really what I do in my practice. Prior to being here in New Jersey, I went to school in Connecticut, where I received my doctorate and master's. And I also spent some time in China, where I studied acupuncture and traditional Chinese medicine. And I came face to face with the awesome therapies that were being used to support individuals. And that's a little bit about myself. Now we're going to chat about traditional Chinese therapies, and those are going to be the ones that are mentioned here: acupuncture, definitely adjunctive modalities like cupping and gua sha and moxibustion, and we'll dive a little bit about what each of those are, so you have a really nice idea of what those things mean. And Qigong, as well as Chinese dietetics and herbal medicine. Definitely would like to mention that this conversation is an educational talk. It's not meant to be a replacement for medical treatment. It is not meant to be medical advice. So definitely consult with your healthcare provider and your oncology team prior to introducing any of these changes or considering doing acupuncture, traditional Chinese medicine. So diving into what some of these modalities are, and you might be familiar with some of them. And the most common is acupuncture, and that is pictured here at the left-hand side. And then we have moxibustion, which is the use of an herb that is nice and compacted into little balls, or it can be little cones, and that is used to warm up the body and create a really nice supportive therapy for warming and improving metabolism, and that is indicated for some individuals. Then we have the use of Tui Na, and Tui Na is the therapeutic massage, and that is used along different meridian systems. And we'll talk a little bit about what meridians are in a second. And you're using specific massage strategies and techniques to move energy in meridians and really support different things, whether it's pain management or improvement of range of motion, those sorts of things. And then there's cupping, which has been a little bit more famous more recently. It's something that we hear more about, and you'll see individuals with maybe some bruising in their neck or in their back, mostly now that it's summertime and you can see people's skin. So if you see any of those circular bruising, that's definitely cupping. And cupping is used to release stagnation and pain and get things flowing and moving. And it also improves range of motion and those sorts of things. And then other than that, not pictured here, we have gua sha. And gua sha is the use of a little tool that is used to scrape the skin. And that's also used for pain management, for improvement of range of motion, those sorts of things. And then e-stim, which is the use of electric stimulation, whether it's placed right directly on the skin or whether it's on the needles that are placed in the body. So you might be wondering, like, okay, so acupuncture, these, TCM therapies, how do we determine what is necessary based on how you're presenting? So in Chinese medicine, there's two diagnostic tools that we use, and you may be familiar with these. This is tongue and pulse diagnosis. So if you take a look at the tongue that's pictured here, you'll see that different areas of the tongue.
Hey, Vanessa.
Yes.
Just wanted to let you know that the slides aren't moving.
Oh, no, they're not?
No.
Oh, that's not good. Okay, that's not good. Let's see. Stop share. Zoom share. I'm so sorry. Okay, can you see it now?
No.
Closing. Okay, let's see. Share screen. How about there?
Still, no, not yet.
Okay. I apologize, guys.
Yep, there we go.
Is it showing there? Okay. All right, perfect. Let me just bring up. Okay, is that better?
Yeah.
Okay, all right. Okay, sorry, guys. So this is what I was showing you. So this is the acupuncture in the top left, the moxibustion, which is the little herb that is compacted in balls and cones on the right, and then the lower, the tuina and the cupping. So that's what I was showing you. And then here is going to be the tongue that I was speaking about. So here you're going to see that there's different areas where it gives us information about different organ systems that are, whether there's under-functioning or over-functioning. And that gives us a really nice idea of how to support you, how to use the specific TCM therapies in accordance to how you're presenting, how your tongue and pulse are presenting, and what is letting us know about your overall constitution, the well-being of your organ systems. And then also at the lower part of the screen, you'll see that there's the pulses. So whenever you go to an acupuncturist, you will get that they'll take a look at your tongue, and then they'll feel out your pulses in those 3 different locations in both of your wrists. And again, that's also going to let us know the health and the well-being of your organ systems, letting us know what therapies are most appropriate to support you in your individual symptoms and constitution. So, acupuncture specifically, you may be wondering, how does it work? So with acupuncture, we're using single-use needles, and they are the thickness of 3 hairs. They're very thin, and they are used at different points in the meridian system. And meridians are, you can think of the meridians of the body as this network of, I like to call them like I guess, roads throughout the body, and each meridian, each road has a purpose. They travel to different organ systems and to different parts of the body, making specific changes to your health. And that is based on, we're using specific points along those meridians based on what we're seeing from your tongue and pulse and how you're presenting with symptoms and your entire health history, of course. That's super important. So how does acupuncture actually work and actually make changes to the body? So that is through the modulation of cortisol, which is our stress hormone. So when cortisol is elevated chronically, which is the case for modern day humans, because we are exposed to a lifestyle of being on the go on a consistent basis, for the most part, we're on cortisol overdrive. And acupuncture does a really nice way of modulating those cortisol stress hormones levels. It also modulates inflammatory cytokines. And we're pretty familiar with what cytokines are now, cytokine storms. And cytokines are these inflammatory little molecules that dictate disease in the body. So acupuncture helps modulate that inflammatory process. Also, people report that after acupuncture, the most common side effect is relaxation and the sense of calm. And that occurs as a result of the pain reducing and mood boosting endorphins. So it's really similar to when you have a really nice workout and you feel really great, even though you did not want to go do that workout before you started. It's the same way with acupuncture. You feel very sent out, very relaxed because of those endorphins. And then something really specific to our talk today is the secretion of neurotropic factors. And those are really important for nerve cell regeneration. And that's going to be really helpful for individuals experiencing nerve damage as a result of radiotherapy or chemotherapy. So that's super interesting to know that. And, we talked about some other modalities that fall under traditional Chinese medicine. Acupuncture takes the spotlight, but we also know the importance of diet, and especially in the Chinese culture and in traditional Chinese medicine. So if you were present at last month's talk, we talked about seasonal eating in the summertime, and we talked about this connection with food. And that's really what Chinese dietetics is about, is creating a connection with food based on the properties that are found in each of the foods that we're consuming. So some foods are going to be really cooling, some foods are going to be very warming, some foods are going to be more neutral, and that's going to be different foods are going to be indicated for different constitution types. And depending on what symptoms and what your tongue and pulse is showing us, there will be recommendations based on what those things are telling us to further support your health. And then, when it comes to supporting individuals that are undergoing oncology treatments, definitely some of the most important tips in based on TCM theory is consuming real food. And this is my absolute favorite concept out of everything we'll talk about, because it focuses on the nutrient density of foods and how important it is for us to consume real life sources of nutrient rich things, rather than consuming ultra processed foods or things that are packaged, or fast foods that are not nutrient rich and have very inflammatory compounds that are negatively affecting our health. So definitely the consumption of eating real food, reducing and eliminating the consumption of ultra processed foods, eating foods that are cooked. And the reason why cooked foods is such an important thing to talk about is because when we're consuming cooked foods, there's going to be a much easier absorption of nutrients. And there's something called nutritive qi. And qi is this vital force and vital energy in the body. But foods have nutritive qi, have this energy and this force, right? So when we're consuming cooked foods, it's much easier to extract those nutrients and to really nourish our bodies. And then with that being said, the avoidance of cold foods, because cold foods can be very stagnating and very cold to the body. And that's not what we want. We want a nice warm metabolism to really continue feeling healthy and strong. And that's super important when it comes to individuals undergoing oncology therapies. And then the avoidance of very sweet foods and high glycemic foods. So, maintaining very adequate levels of blood sugar and making sure that there's no blood sugar spikes is going to be also extremely important. And consuming foods on a regular basis, not avoiding skipping meals, and just really making sure that you're making a connection with food. And that's going to be really key and helpful. And it's something that's at the core of traditional Chinese medicine. And to share a little bit about my experience when I went to China and spent some time there, a lot of their meals are community style, and a lot of their restaurants are, you go to, sit down with a group of people, and it's in a circular table, and we're all sharing food, and it's this such deep-rooted connection, and using food as medicine and connection, super helpful. And, in comparison to the type of lifestyle we have here, where, we're constantly on the go and we're eating in the car, or we're eating between meetings, or we're not eating at all, there's no sense of connection to food and to eating. So it's definitely interesting to see that, or, that difference in cultural habits. And then, there's also another Chinese therapy that I wanted to highlight, and that is called Qigong, and it is movement medicine, right? And this is really a practice that is very contrary to our current lifestyle, which is being on that cortisol stress hormone overdrive, being on that sympathetic overdrive, which is when our nervous system is wired and going a mile a minute. Qigong is actually the complete opposite. It nourishes our parasympathetic nervous system. And the parasympathetic nervous system is the part of our nervous system that really just provides the body with that rest, that relaxation. And really interesting is the part of the nervous system that allows us to digest food and to have proper food absorption, which is super important. So Qigong is a practice of slowness and mindfulness. And the word Qi, it can sometimes mean like the interconnection with ourselves and the world around us. And the practice of Qigong is just that, creating this interconnection with our bodies, our minds, practicing that mindfulness and really connecting to the environment around us so we can show up as our best selves. So also really important, another concept is this idea of having really nice adequate qi flow. And I talked about how qi is this vital force or this vital energy in the body. And Qigong allows for that nice flow of qi throughout the body. When qi becomes stagnant, or it becomes it just becomes stuck, it doesn't prevent for adequate health and for an awesome well-being and sense of well-being. So we want to make sure we have really nice qi flow to really support our health, our metabolism. And other forms of really nice gentle movement that will support that nice qi flow is Tai Chi, walking, yoga. Those sorts of things can be very nice and supportive for that parasympathetic nervous system to calm it down and make us feel grounded and safe and comfortable, which is so, so important for the human body. So that's really interesting. And then the other piece that acupuncture really focuses and traditional medicine focuses on is this emphasis in the mind-body connection. So, we talked about on our last month's talk about joy being the positive energy of the heart and the energy of the summertime. And that's really what traditional Chinese medicine focuses on. There's different emotions for different organs in the body based on Chinese medicine. So, for example, grief targets the lungs, and anger targets the liver, and doubt and worries can target the spleen. And all of these organs have a really important role in the human body based on Chinese theory. So it's really important to also take a look at your tongue and take a look at your pulse and say, okay, your body's showing you this, and this is how we can support you with acupuncture, traditional Chinese therapies, as well as working on improving your mental emotional health, because we know that there's such a direct correlation and between our emotions and our emotional health with our physical health. And what I love about Chinese medicine is that it really embraces the fact that we all have our own story, that we all have a different upbringing. We have different factors that made us who we are, who we're currently becoming. It really embraces this concept of individuality. And it's really important to know how all of these things have created, different emotions in our body, right? Like our upbringing and what we experience, how that has created some grief in our lives, or how it has created some anger in our lives, or some worry and overwhelm, and then how those emotions then go and target different organ systems and then show up in the body as disease and symptoms. So it's a really interesting piece of traditional Chinese medicine. And I wanted to highlight this meta-analysis and review that took a look at 6 different Chinese modalities. So they were looking at acupuncture, Chinese massage, 5-element musical interventions, which is the use of different sounds at different hertz to target different organs, which is really interesting. And then Qigong, Tai Chi, and dietary supplementation. And they were looking at how this is going to affect pain relief, the remission of depression, and also looking at digestive health and flatulence. So, and this was following surgeries. So it was really interesting to see that these 6 therapies actually showed to prove beneficial effects by reducing fatigue and gastrointestinal distress in these individuals that were post cancer related therapies, and overall improving the quality of life. So it was really interesting to see how that played a role in mental emotional health, and how acupuncture supported fatigue and supported depression and digestive health, which is directly correlated with emotional health. And so you may be wondering, like, okay, so what things have been shown to support individuals that are currently undergoing chemotherapy, I just got my words tongued up. And it's really interesting that the literature is showing some promising results. So for chemotherapy support, there was a really nice study that looked at post-operative gastric cancer patients. And this was individuals that received their first cycles of different chemotherapy drugs and were also using anti-nausea meds. And then they use this one point on the body, this acupressure point, which is called pericardium 6. And it's a point that's 3 fingers from your wrist crease. So if you take a look at the wrist, it's like right in this area. So right in between the tendons below the wrist crease. And they use 5 minutes of acupressure 3 times per day prior to chemotherapy treatments and during meals. And this seemed to improve the severity of nausea, vomiting, duration of nausea, and the frequency of vomiting. So this was fantastic. And then another study that was done on individuals with stage 1 to 3 breast cancer, it showed that acupuncture supported the improvement of fatigue, anxiety, insomnia, and these studies were not very big, but it shows really promising data to further look into acupuncture a little bit more. So it's a good example of how acupuncture and Chinese medicine can be supportive for individuals undergoing conventional cancer care. And then, for radiotherapy support, there was a nice study that was done for individuals with oropharyngeal or nasopharyngeal cancer, and they were undergoing radiation therapies in China and the US. And it showed that those individuals that were undergoing acupuncture support had a reduction in radiation-induced xerostomia, so dry mouth, and they experienced fewer and less severe symptoms after 1 year of treatment, which is fantastic because, some of these side effects of conventional cancer therapies can really affect one's quality of life. And we know that there's so many other options that can be utilized in conjunction with conventional cancer care to really support individuals throughout their journey and thereafter. So, when it comes to those individuals that are cancer survivors and really want to set up a plan for ultimate success after their conventional cancer therapies, we know that with traditional Chinese medicine, the most important thing is addressing any pre-existing deficiencies or excesses. And we talked about how we determine those based on the tongue, the pulse, the symptom picture, and how the person is presenting. And then we are utilizing things like acupuncture and cupping and the gua sha and moxibustion, or e-stim, or even ear acupuncture, which is really it's a more gentle but very powerful approach as well. And then we're using food as medicine, so Chinese dietetics, and focusing on the quality of food and the relationship with food, which is extremely important. And then Qigong, to have that nice Qi flow and having that nice metabolism and really supporting that reduction of cortisol, the reduction of those stress hormones that are going to cause havoc in the body. And ultimately, what we want to do is create this really nice balance of yin and yang. So if you were there at last month's talk, you'll see that, yin and yang are these properties that really balance each other out. So it's kind of like the seesaw. Yin is more cooling, grounding energy. Yang is more fiery and upbeat energy. And we want to create a really nice balance of both, because when there's an overdrive of one of them or an underdrive of one of them, that can lead to disease. So we want that really nice flow of yin and yang, and definitely that smooth flow of qi and blood. So in Chinese medicine, we focus on these 4 elements: yin, yang, qi, and blood. And we're modulating these 4 elements with acupuncture, the needles, the different therapies. And that's what we would utilize to support individuals after their conventional cancer care, to really make sure that you're set up for success and are being supported in feeling your absolute best after these therapies. And really interesting, there was a study that was done very close to us in New York and some areas in New Jersey. And it was a study that was done by Memorial Sloan Kettering. And they worked with 360 cancer survivors that were experiencing chronic musculoskeletal pain. And it showed that after 12 weeks worth of treatments, they saw that there was a reduction in pain severity with the use of electro acupuncture and auricular, that ear acupuncture that I mentioned. And that was really interesting to see. And it's awesome that it's something that's, that took place, a study that took place right in our own backyard, which is fantastic. So there's a lot of promising results with the use of acupuncture, traditional Chinese therapies, to really support individuals that are undergoing cancer therapies and thereafter. So, I wanted to set some time to answer some questions that are the most common for individuals undergoing conventional cancer therapies and thereafter. So one of them is, how often or what is the frequency of treatments? So typically those are done once or twice per week, depending on your symptom severity, how you're presenting. And the length of treatment is usually between 6 to 12 treatments. That is definitely, an average. Some people may require more depending on how they're presenting. And then for individuals that are experiencing low immunity, decreased white blood cell count, there's an increased risk of infection. Knowing that these needles that are being used are single-use needles, and there has to be a really adequate cleanliness in the environment for you to feel safe and comfortable. So that's something definitely to keep in mind. And for individuals that have removal of lymph nodes, or there's an increased risk of lymphedema, we in Chinese medicine use points on different limbs, on different on different limbs. So we'll use it on a different arm or a different leg or that sort of thing to prevent any increased swelling or increased risk of lymphedema. And definitely the avoidance of using acupuncture needles on tumor sites. So using points not around that area, in different limbs, in different body parts, to really support individuals that way. For individuals that are undergoing chemotherapy, not having acupuncture 24 hours before and 24 hours after. That's typically the rule. And then for radiation, considering that you may be using different oils or creams during acupuncture treatments, but knowing that those need to be removed prior to radiation therapies. So super important to keep in mind as well. So those are typically some of the, things that come up. And I would like to open up the floor for any questions, or Kyle, if there were any questions in the chat, we can definitely go over those now.
Of course. So there is a question. Someone asks, what is the difference between Qigong and Tai Chi?
That's a great question. So Tai Chi is more of a flowy practice where it's like there's certain types of movements that are being used in tandem with each other. So it's more of a continuous practice versus versus Qigong is more of like a, I guess in a sense, like as you go type of practice. Tai Chi is more structured, I guess, in a sense, and Qigong is less structured.
Okay, thank you. That was the only one that was in the chat box and the Q&A. If you have any questions, please feel free, or any comments, feel free to drop them in the chat box, or you can use the Q&A feature.
Absolutely. Did you have any questions, Kyle?
I didn't. I don't. I think that was a really wonderful presentation. It really gave a glimpse at pretty much what acupuncture is and how it's used and the benefits of it. So, and also you did touch upon a lot of the frequently asked questions too.
Yeah, absolutely. And that's super helpful just because, it's good to go over those and definitely give people peace of mind that working with a licensed acupuncturist that is familiar with individuals that are undergoing, conventional cancer therapies, it's super important. So that's definitely something to keep in mind. Working with a practitioner that's going to really understand conventional cancer care, as well as, herbal medicine and how those things interact with conventional cancer therapies as well. So working with individuals that are knowledgeable in that arena is going to be really important. So fortunately, there's a lot of awesome acupuncturists that are very familiar with that. So that's great.
Okay. So there actually has some questions came in. So one of them, someone asks, what do you look for in someone's tongue and pulse to diagnose their health?
So we're looking at those different areas that let us know the health of each organ. So the sides of the tongue lets us know the flow of your liver and your gallbladder. The tip lets us know the health of your heart, and the slightly above the tip, it's like the health of your lungs. So it's really interesting. Take a look at your tongue and really assess like what areas you might see a little bit of redness in the tip, and those individuals may be experiencing a little bit of insomnia or some anxiety and heart racing and some of these things. And we're also taking a look at, so not only the health of each organ, but we're also looking at the quality of the tongue. So we're looking at the coating and what is the coating telling us? If there's a yellow, orangey coating, there may be heat in the body or dampness. And dampness is this concept where things just get stuck. And you want to move that. You want to move that dampness because that's what causes disease. And that's what causes a lot of pain. And it can cause different things. So definitely the organ systems, the coating, and even if you don't see a yellow orangey coating, you can see a thin white coat. And that might tell you that there's some coldness in the body. And that's where those therapies like the warming moxibustion, the little herb that was packed into a ball and placed over the needles, might be really helpful. So depending on what the tongue is telling us, is letting us know, okay, this is the right therapy for today, and this is our treatment plan moving forward. So it's really interesting. Just take a look at your tongue and notice what things come up as you do that.
Just noticed I was muted. That was great. Thank you, Vanessa. Another question is, when would you use electro or ocular acupuncture?
Okay, so for the auricular acupuncture, the ear acupuncture is a therapy that I commonly use for individuals that may not be as familiar with acupuncture and might be a little bit more hesitant to get started with needles. As we talked about, they show some promising results. So we're using different points in the ear based on the symptoms that you're presenting, the tongue, the pulse, all that good stuff. So that's when we'll use ear acupuncture. Ear acupuncture is also awesome because you can use ear seeds. And ear seeds are these little stickers with little balls that you put in your ear, and you remove after 3 days to reduce the risk of infection, especially in the summertime where we're sweating more and we don't want those in for long. You can use those ear seeds and take those with you, and you can use them to decrease your stress levels. You can use them to reduce pain and to manage like symptoms like anxiety or to boost your mood, that sort of thing. And then electro acupuncture is a therapy that's used primarily for pain management and to increase range of motion. So, prior to us getting on, I shared a story with Kyle about one of my first encounters with individuals undergoing oncology care and using acupuncture adjunctively. And it was this woman who was experiencing decreased range of motion post-surgery. So could not put on her clothes, could not open cabinets to her kitchen. And it was such an impressive thing to see how she progressed throughout the course of the acupuncture treatments. And one of the things that were used was electro acupuncture to really improve the range of motion, to really get things flowing in those meridians that we talked about, and just really supporting her ability to open cabinets and make her own meals and put on her favorite shirt and hug her puppy. Like it was like the most beautiful thing to see. And that's when acupuncture and Chinese therapies can really come in handy, really supporting the quality of life while individuals are undergoing therapies that can really make a difference, right? Like individuals with dry mouth that can't eat and are becoming malnourished, right? Like if we can reduce that and improve your nutrient status, that's going to improve your health outcomes and outcomes with the cancer therapies that you're undergoing, right? If you're nourished and your body is nice and strong, you will do better. So that's really the role of acupuncture and Chinese therapies, to really strengthen the body and to provide you with a strong sense of well-being so you can be nourished and can take on these therapies really well.
Awesome. Thank you, Vanessa. Someone asks, can someone with a pacemaker have acupuncture?
Yes, they can. Definitely not with electro acupuncture, and making sure that, we're monitoring symptoms, we're doing a really thorough intake, making sure that we're doing a very thorough physical exam, and using the adequate, acupuncture protocols to really support your well-being. But that definitely can be done.
Someone asked, when is cupping recommended?
So cupping is usually recommended for the improvement of range of motion, of pain management. So individuals that are post-surgery and they need to improve, like I mentioned, the woman with post-surgery from breast cancer treatments, and we did some cupping as well. So that is going to improve range of motion. And cupping is also, interestingly enough, it's used to do something called releasing the exterior. So in Chinese medicine, when you release the exterior, you are getting rid of, little pathogens like, viruses, bacteria, like, supporting individuals that maybe have like a cold, or have like the flu, or, they're experiencing those sorts of things, and you want to move things from inside their body and releasing it on the exterior. So you can use cupping to support somebody for those types of symptoms. And definitely for pain management, range of motion improvement, releasing the exterior.
Awesome. Another question is acupuncture used to treat chronic insomnia?
Yeah, so with acupuncture, we're using what the Chinese pulse, the tongue, and the symptoms are letting us know, right? So, we're using, even though you might be coming in with an actual diagnosis of chronic insomnia, we're going to transfer that to the equivalent in Chinese medicine. So very often for chronic insomnia, there may be a few things happening, but we talked about that nice balance of of yin and yang, right? For individuals, yin, the time of the nighttime, is that yin time, that cooling, grounding time. When there's not enough yin in the body, that's when people start experiencing some of that insomnia. So that's when creating that really nice balance of yin and yang is going to be super helpful for those individuals.
Someone else also asks, how often is acupuncture used in cancer treatment? Success rate, success in controlling anxiety, and does insurance typically cover acupuncture for cancer treatment?
So the treatment frequency really just depends on how the individual is presenting. For the most part, definitely 6 to 12 treatments, at minimum 6, to really start seeing changes. Acupuncture works very similar to when you go to the gym, right? You start working out and you might see, your strength training, you might see some changes in your muscle growth. But after a few sessions of going to the gym and strength training for a while, you're going to see really robust muscle strength and increased muscle growth. So works very similar in that sense. It's a cumulative effect that happens over the course of a few sessions. So definitely 6 to 12 treatments. The success rate is really just based on the individual. And that's why, having studies on acupuncture can sometimes be challenging, right? Because it's a very personalized approach, right? We talked about how we're basing these therapies on tongue and pulse. We're basing them on individual symptom picture and health history. So it's a very individualized approach. And for these type of approaches, creating a standard improvement rate or success rate is very challenging. But it just really depends on how you're presenting throughout the course of your treatments, your acupuncture treatments, and then kind of modulating the treatment based on those changes that you're presenting. So that's definitely, something to consider. Everyone will react differently to acupuncture. Some people will react well in one session. I've seen it happen over and over again. Some people will literally take 3, 4, 5, 6 sessions. So it just really depends. And then the other question was insurance coverage. So yes, acupuncturists typically take insurance. That can definitely be done. Some acupuncturists work out of network, and they provide services that you pay, out of pocket, and you can get reimbursement through your insurance if you put in a claim. And acupuncturists that are out of network will definitely provide you with those, those information, so you can get insurance reimbursement if that's something that you would like.
Awesome. Thank you, Vanessa.
You're
Those
very
were
welcome.
all great questions, and I'm so happy that our attendees are asking them.
Absolutely.
There weren't any other questions in the chat box, or there's some in the Q&A. What Chinese herbs do you use in your practice? Are they made into a tea? How do they help?
So in my practice, I do not use Chinese herbs. I use nutrients and different herbs with individuals that I support with naturopathic medicine. But in order for an acupuncturist to use herbal medicine in New Jersey, they have to have an additional license and additional education. So that's the reason why I don't personally use them. But there's a lot of acupuncturists that do, and they're very knowledgeable how to do that. Chinese herbs are very interesting, and after my experience being in China and see how they work, it's really interesting. Those docs over there, they're using Chinese herbs, they're using acupuncture, they're using electro acupuncture, they're using Chinese dietetics, and they are running CAT scans, and they're running MRIs, and they are using blood work, and it's such an integrative practice that I have definitely seen those. When I was there, I saw a lot of people improve beautifully with the use of all of those integrative therapies, the herbs, the conventional approaches, the diet, the acupuncture. It was really awesome to see that.
Do you analyze blood work in each of your patients?
For individuals that I work with with naturopathic medicine, yes, I go through thorough blood work. I use functional lab testing, which is a step up from conventional labs that take a look at your health in a much deeper level. So definitely I do that with my naturopathic patients, as well as using insurance covered labs, that we can run through your healthcare provider and make sure that we're getting insurance coverage to really get those assessments done. But I absolutely do that. For individuals that are that I'm supporting with acupuncture, Chinese medicine, I'll take a look at them if they bring them, and then we chat a little bit about what those mean and how there may be some things that can be assessed based on those labs.
Okay. You mentioned use of acupuncture helping with digestive issues related to cancer treatment, but could it also help with pre-existing issues on the person? Gastritis, acid reflux, ulcer?
Absolutely. So my practice is based on gastrointestinal support, and in combination with naturopathic medicine and acupuncture, you can see really fantastic resolution of symptoms and really getting to the root cause of digestive issues. Digestive issues, for the most part, have a root cause. There's something that's happening where there are symptoms that are presenting. I like to describe symptoms, especially digestive symptoms, as signs from the body that something's not going right, that something is happening that needs to be further addressed. So we do that with functional lab testing. We do that with labs that are covered by insurance. We do that through very thorough intakes. So very important to, address the root cause of digestive issues. Acupuncture will also support individuals with cancer issues prior to any conventional cancer treatments. So, individuals that have IBS or Crohn's, ulcerative colitis, or any other diagnoses that, they haven't found resolution to, acupuncture can definitely be supportive for those things.
Okay. Another question came in. Have you used acupuncture to treat colitis / ulcerative colitis? I believe I'm pronouncing that correctly in patients. I understand acupuncture is very broad in its applicability.
Correct. Yeah. So when it comes to ulcerative colitis, you were close, Kyle. You did good. Yes, acupuncture can definitely support that. And like I mentioned, considering that there's a root cause to a lot of these gastrointestinal issues and digestive health, we talked about the importance of digestive health because that's where the absorption and assimilation of nutrients is going to take place. So, individuals that consume like really nice, clean diets, but can still be malnourished or can still be not feeling well because there's an inability for their bodies to absorb nutrients. So, in the case of digestive issues for individuals, definitely enhancing that ability to absorb and assimilate nutrients so you can have better outcomes with oncology therapies. But, with ulcerative colitis, definitely reducing flare and, putting individuals into remission and really getting to the root of what's happening there. So acupuncture can definitely support, as well as doing a more in-depth approach with naturopathic medicine.
Awesome. So that is up. I think another question came in. Where in Westfield are you located? Do you take NJ Family Care Insurance?
So I'm located in Lenox Avenue, which is fairly close to the downtown area. It's on a street where there's a handful of different healthcare offices and businesses. So I'm in that area. And then in my practice, I'm an out-of-network provider. So I will provide individuals with a very detailed report of expenses and everything that was covered with acupuncture treatments. And then individuals can go ahead and submit those to their insurance.
Okay. So that was all of the questions that I have right now. Carol, I'm going to give me 1 second, Carol. I see your hand raised. So I'm going to stop the recording.